Welcome back. Today we're going to conclude our look at tropical diseases with several other diseases which are, again, endemic and epidemic in much of the zone around the equator and have been pretty much eliminated on our continent. The first one is called Schistosomiasis, and if you go to Africa or Asia where this is found, it'll be called bilharzia. Bilharzia was the name given to it after Theodor Bilharz, who was a German investigator who discovered this cause of this disease about 150 years ago. The organism is what we called a trematode, or a platyhelminth, a flatworm. Again, remember, these worms are the ones that outnumber us in mass by a lot. It measures about 7 to 20 millimeters, so it's quite big. You could actually see one of these worms. And it's a very, very important cause of disease. It's not as common as malaria, but it's very disabling, a great source of illness and economic damage. It afflicts more than about 2 million people worldwide and about 300,000 deaths a year. Now, humans are the definitive host, but there are other reservoirs in nature, so it would be very hard to eliminate. Dogs, cats, pigs, wild rodents, and goats can all harbor this parasite, this worm. The intermediate host is the freshwater snail, a small snail found in the slow-moving waters in these regions. And the extent of spread is here in the first slide, and you can see it's all across South America, Africa, and into Asia. It's endemic in 74 tropical developing countries. And it's interesting that when they built the Aswan High Dam and created this backup, the Nile River flows north into the Mediterranean. Here's the city of Aswan and the site of the High Dam. And it created Lake Nasser back here that backed these waters all the way up into the Sudan and beyond and slowed down the movement of the Nile River. What happened was this snail, which had been continuously washed downstream and kept there by the current of the Nile, began migrating backward in the wake of this dam and the slow movement of the water, and in fact brought this snail to about 6 million more people than it had been before the dam was built. About 60 to 70 million children in 54 countries have this very, very debilitating disease. And in fact, in the area around Lake Volta in Africa and Ghana, over 90% of the children are infected. Now, the life cycle of this parasite I'm going to show you in 2 slides. This first slide will start in the human host. The swimming form, which is called a cercaria or a cercaria, gets into the human skin by people getting into the warm, slow-moving waters. They wade or swim or get into irrigation ditches in their bare feet without protection. And this is one of the few worms or even creatures in nature that have strong enough proteases to break down our skin and can get into undamaged skin. Most organisms need damage like a wound to get into a skin, and these are able to get into the undamaged skin. Very, very rare. It breaks down the keratin and then the protein layers and actually swims right in. Inside, the adult worm shed their skin, which makes them, the skin that they had on before they got out of the fresh water was to protect them from the fresh water because they have a salt milieu the way we do, and our skin protects us from dehydration, and they're being protected from an osmotic swelling in fresh water. They get into the skin, they shed that, and that stimulates human anti-schistosome antibodies, which actually causes more problems than the worm itself. I'll tell you about that later. So the worm, and this is kind of very cool, this is the adult worm, and the big one is the male, kind of like a hot dog bun or a slipper shape. And cuddled inside the slit is the female. And if you want to see what this really looks like, this is a scanning electron micrograph. And basically the big part of this is the male, and this more slender one curled inside is the female. And they swim together. It's really rather romantic. And they swim in the bloodstream, and they create eggs. They go to different organs depending on the bloodstream they're in, but most of these can get into the liver and the lung by the various venous circulations. And in this organ, they mature and then to this form, and they produce hundreds to thousands of eggs per day for up to about 5 years, which is their life expectancy. And they elicit an enormous immune response. The body doesn't like these, and it starts forming scarring, inflammatory changes, and granulomas that we talked about previously. Now, many of these eggs will then get into the intestinal wall via the portal vein, which is the vein that drains the intestines, and then they get into the intestine and they're shed into the feces, and if their sewage system allows it, that gets back into the fresh water, which is what happens in most of these countries. And then the eggs develop into this called a miracidium. And this is the swimming form. It has these little flagella here all around its body. And it completes the cycle through the snail. There's the freshwater snail, which is called a mollusk. And it develops in the snail, releasing a sporocyst. This is the form that's encased to protect it. And finally, the Cercaria. By the way, the Cercaria lose their tail after they swim into the human because they no longer need it. Let me show you about the way the life cycle looks in more schematic form, because I want you, again, to see the forms that take shape here, because there are several different ones. Here's the Cercaria swimming in the fresh water, penetrates the skin, and then gets into any one of the other organs. Can get into the intestine, can get into the lungs, the liver. And as it moves on, and these different locations are the preference of 3 different kinds. Schistosoma mansoni, which has a little spike on the side of its body here at the edge. Schistosoma japonicum, which has no spike at all. And Schistosoma hematobium, which means bloodborne, which has an end spike. And that's how we tell them apart. We look at their spikes. And inside, they develop, penetrate tissue, they circulate, and then they actually swim in the portal blood. Here's that male and female I showed you, all snuggled together. And then they do their egg laying, which get out into the water again, going through the snail. I'd like to show you what they really look like. Here's japonicum, egg. We look for these eggs in the feces. This is how we tell them and make the diagnosis. You can also find them in the urine. And here is mansoni with that spike on the edge. And here's some of the damage that you will see, called pipestem fibrosis. This is a liver of somebody who's died. This is a vein in the liver, probably the way they got in, causing all this fibrosis of tissue. You look here, here's the egg hematobium, which gets in the bladder, and the eggs calcify. All this dark blue staining is calcification. The body puts a tremendous inflammatory response around these eggs, and these patients have a worse reaction, as I said, to the eggs. For example, here's another one. Here's mansoni with lots of scattered white cells and inflammatory cells, including those eosinophiles. The pink you see are the eosinophiles that we talked about as a response to the allergic reaction. Now, these 5 groups have different symptoms. Mansoni and intercalatum get into the liver, the lung, the intestine, the spleen. Hematobium is mostly the bladder and the kidney, and these are in different geographic areas. Japonicum, obviously by its name, is in Japan, and Mekongi from the Mekong Delta is in the intestines. The symptoms of this disease are recurring high fevers, spiking high fevers over a period of time, hematuria, urinating blood, in hematobium mostly. They they urinate blood, and in many countries, the first time a young man or woman urinates blood, that's the sign of maturity. That's the coming of age. They've lived long enough to have this infection. A very sad commentary. They get coughed from the respiratory effects. They get abdominal pain, diarrhea. They get enlargement of their liver and spleen, and they get brain symptoms. They get increased obstruction of their liver, causing some of the same symptoms as you get in patients who have alcoholic cirrhosis. Again, we diagnose it by finding the eggs in the stool or the urine. The fibrosis is really the bad effect here, the scarring, and the granulomas can be extensive. They can be throughout the entire body. We prevent this best by disrupting the cycle. The drugs against this are effective, but it would be really nice to disrupt the cycle. So one of the things they do when people are building new irrigation dams on a small scale or even bigger scale, what they want to do is wipe out the snail. Once the snail's out of the equation, the disease stops because that's an obligatory part of the cycle. And there is a molluscicide that's naturally occurring. It's harvested in Ethiopia called soapberry endod. It's a naturally occurring soap, and you can, first of all, get the people to wash themselves every time they get out of the water before these larvae swim through their skin, because it kills some of the swimming forms, but mainly it kills the mollusks, the snail. We'd like to get rid of the snail. We treat this disease with 3 drugs. It's almost like chemotherapy. These drugs can be very toxic. This first one, praziquantel, is effective for all the schistosome species. It's a long course of treatment, but it's relatively safe. Oxamniquin is exclusively to treat the intestinal form in South America and Africa. Again, this has some toxicity, and metryphenate is only for urinary schistosomiasis. So this is a very important disease, one that's very widespread. It has rather dramatic life cycle, as you saw, and one which we would like to see less of, but unfortunately still millions of people are living with this disease. I want to move on now to another disease called filariasis, one you've probably heard snippets about, but may have not had a real in-depth survey. This is a group of organisms known as nematodes, or unsegmented or roundworms. Again, that same kind of group. They're transmitted to the human host mostly by insect bites and not mosquitoes, sometimes flies, in about 120 million people in 80 countries. Just think of that, 120 million people are infected with various forms of filariasis. And about 40 million are so badly infected that they're virtually cripples. Now, it's very rare in the West, by the way, we see almost nothing of it. The 2 main organisms are called Wuchereria bancrofti and the other one, Brugia malayi. Wuchereria bancrofti is about 90% of all this kind of infection. The most dramatic form blocks the lymphatics. They get out of the bloodstream, they get into your lymphatics, which, as you remember, drains the tissues of excess fluid. So, of course, what's going to happen to these patients, wherever the obstruction is, they're going to get edema, swelling. If they get it in the leg, then their legs will be swollen. If they get it in the arm, their arms are swollen. And we call this elephantiasis. This is not elephantitis. That's what most people call it. Now you know about what itis means, so elephantitis would mean inflammation of your elephant. This is elephantiasis, which means an appearance like an elephant. And here is for some of you, may be an unpleasant picture to look at, but this is a case of elephantiasis of the legs due to filariasis that have got it into the lymphatics, probably up here in the patient's thighs, and blocked all their lymphatics. You can imagine what this poor person has to put up with living with this kind of disease, and it's absolutely incurable, at this stage and not going to be able to do anything for the patient. Here's an example of what's happening. Here are the lymph nodes. The fine lymphatics can get clogged, and it causes back pressure. Now, the male and the female organisms are released during, again, either the mosquito or the fly, in this case in the mosquito's blood meal, and they mate in the bloodstream, and they release what are called microfilaria. Here are the microfilaria. You can get an idea of the size. Here are white cells. This is probably a plasma cell, but here's maybe a poly or one of the other white cells. And here's the size of the microfilaria. Here's another one with a different stain. This is Brugia malayi in the bloodstream. They're often asymptomatic for a long time. It takes time for these worms to get into the point where they create the elephantiasis. They also cause something called pulmonary tropical eosinophilia. Remember, the eosinophiles are going to come and be prevalent in the blood to get at these parasites, and these patients have cough and wheezing and fever, and of course, when we look at their blood smear, it's full of these guys and eosinophiles. They can get eye lesions, and they can progress to blindness. They can get pains in their joints from the bug in their joints or the worm, headaches, fever. They can get enlargement of their liver, and then itching all over the body from the reaction of the immune system. So although this doesn't kill that many patients, it makes them absolutely miserable. They can get severe immune damage in other places of the body, basically by the immune response to the parasite itself. Now, there's a form of filariasis that's really quite dramatic, and this is called loa loa. Loa loa is another microfilaria. It is transmitted by this player. This insect is called the Chrysops species. It's a fly that lives in the endemic areas, and again in Asia, India. It's often asymptomatic. It's another airport disease, and again, what happens is sometimes we see these patients coming through the big cities on their way back. I had a patient who was a Pan Am stewardess when I was a medical student, and she had just come back from a flight from New Delhi, and they had stopped over in New Delhi for 1 hour. And she went out to a local outdoor bar and had a drink with the pilots and got back on the plane. That was her total exposure to New Delhi. She got back, and a few weeks later, she had something in her eye. She kept blinking. She thought she had some dust in her eye, and she went to a mirror and looked and became absolutely hysterical, she told us, because she saw a worm crawling on the surface of her eye underneath the outer layer. And she got herself together, got herself to the emergency room, where we called the entire medical school class down to see her because she had loa loa. This microfilaria has a propensity to get into the eye. This is a picture that some of you may find hard to look at, but there is the filaria. There's the worm under the under the sclera, the surface layer. It's actually conjunctiva, which is transparent, but this is underneath that layer. And this can be removed by making, under local anesthesia, a very small slit and using a tweezers to remove the actual worm, which we did for this young woman, and who was very relieved. But when you treat these patients, they have a similar problem to the Herxheimer reaction I talked about. They get an allergic response to the dead worms that are still in their body, something very unusual called calabar swellings. They get swellings on the back of both hands, right near the wrist. I don't think anybody can explain why there, but it's very specific. It can be treated with the same anti-helminthic drugs, anti-worm drugs, similar to schistosomiasis. So this is another disease that we don't see here, thankfully, and it's located now mostly in West Africa. This is the most important distribution area of the disease right now. It's been eradicated in most other areas by trying to eradicate the vector. Those are the roundworms. I want to talk to you now about another group called tapeworms, one which unfortunately we're a little more familiar with in this country. These are multicellular organisms and they're segmented, and each segment is a unit. It can reproduce, it can cause infection, and they come in long rolls like a roll of tape. They're flat, they're eukaryotic, so each segment has all it needs to replicate, and they're almost always ingested orally in undercooked meat or fish, as well as by direct skin penetration. Another one that can get in through the skin, certain varieties. They can dwell in many of several different body tissues. They can live in the muscle, as here the pork tapeworm. These are all called Taenia, the two on the top. Taenia solium is the pork tapeworm. Taenia saginata lives primarily in beef. And this one, Diphyllobothrium latem, is the fish tapeworm from eating raw or uncooked fish, not adequately cooked fish, which has gotten more popular because of sushi. It's interesting, there was a spike, almost a mini epidemic in New York many years ago of this one, Diphyllobothrium latem. And the epidemiologist had trouble figuring it out because it was in grandmothers and their preschool granddaughters. And they looked into this and they were amazed to see how consistent this was. The family would come in, the preschool grandchild and the grandmother would be there with this fish tapeworm. And it turned out most of them were Jewish and were making gefilte fish, which means the mixed fish. And the way they do this is they take raw fish, chop it up, make it into small little balls, and then cook it. And they used to taste the fish while they were making it. And the little girls were helping their grandmothers make the fish for the holidays, and they tasted it to make sure the fish was okay. Then they cooked it. And so they got this outbreak of Diphyllobothrium latem, the fish tapeworm. Each of these segments, they can range from only a few millimeters up to about 30 feet long. T. saginata can get to be about 15 feet long and about a half an inch wide. This is a big organism to have living in your body. The human host is the definitive host, and sexual reproduction, maturity occurs in that host, and then it moves out into the feces, into other animals, which get involved in eating garbage or other impure sources of food, and so the cycle is completed. Here is the cycle. It starts, let's look at it and start it around here by just looking at the different forms. Here are the eggs, which look like this, and then here are the segments. These are the long segments, each of which carry enough genetic material to reproduce. Then the cattle eat the garbage. They get into the meat of these animals and the digestive tracts, but mainly into the meat. And here's pork, and then they hatch and they get into a cystic form in the muscle. So you've got to eat the flesh of these animals. We ingest either the undercooked form or raw form. Now it's getting very popular to do that. And there are a couple of other things that are important here. First of all, as you can see, these segments can get very long. The big end here is the mature end. The little end up here is the head. Now, sometimes people pass segments and they think they're cured. They actually see these in the stool and they think they're cured. But the head is called the scolex, and I'm going to show you a picture of that. And the scolex will attach to the intestinal wall with hooks and not let go. As long as there's an intact scolex, then there's the potential for more breeding. So almost the entire 15 or 20 feet can come off, be passed through the feces, but you'll still be infected. Here's the one from T. solium, T. saginata. I'm going to show you what they look like in real life. Here is the scolex. from T. solea. So here are the beginnings of the segments. These are stained so they can be seen better. Here's that head, and look at the tiny little hooks on the end, and that's how they attach to the intestine. It's really quite amazing how they look. The patients usually will have some form of abdominal pain with this. They get diarrhea, cramps, and they can invade other organs outside the intestine, especially T. soleum, this one right here that you're looking at, and they can actually cause cysts in the brain, the liver, the lung, and the eye. So this is a very bad one to have. Let me give you a little look at these. This is a specimen of T. saginata that's 12 feet long. This is a ruler to show you the size. Scolex is probably here and gets bigger as they mature and hang on to each other, and all the nutrition goes this way through the worm. A close-up, this is the same one. Here's your inches, and look how big the segments can get. The mature segments can get very, very big, again, with the tiny little scolex here. So that scolex is just, a few millimeters. But the rest of it, look at this is 2 inches long for one segment. Each of them can produce many, many eggs at a time without ever leaving. These don't have to leave the body to produce the eggs. They produce the eggs that go out into the intestine, and then they are excreted in the feces and reinfect. There are other organisms like these. There's trichinosis, which are other worms that insist in the pig. We've probably gotten rid of trichinosis by being more careful and cooking the garbage that we feed our pigs. It's kind of a funny concept. Pigs are still fed slops in many places. This is a different kind of an organism. It does insist inside muscle and can be transmitted to humans, which then goes into their muscles and is a very painful disease. But those are usually from pigs where the garbage hasn't been cooked to kill the trichinosis itself. So this one is basically could be controlled by either purification of drinking water before the animals get to it, and adequate curing or even freezing of some of the meats and fish. There are a lot of other worms like this that are prevalent out there among fish. One of the good things is that you can purify these by freezing them. Now, that's not true about many of the bacteria and many viruses. They can be frozen at low temperatures for hundreds of years, if not more. But with these, if tapeworms and other worms, if you take the fish that you would like to eat either raw or smoked, like lox, which is smoked salmon, the smoking is not enough to kill the parasites. And although it's very rare to get parasites from something like lox, you can still get it. A good thing to do when you buy vacuum-packed lox would be to put it in the refrigerator, go on the internet and see the exact temperature and the duration that's necessary to kill these worms. It's really something that's achievable by home freezers, usually temperatures well below 0 Fahrenheit for several weeks, 4 or 5 weeks, and then you're eating a perfectly safe either raw or smoked fish. That's good procedure. The other thing you can do, this one is coming back to these parasites, the tapeworms. These can be treated with drugs, and the important thing is to have a drug that kills the scolex. So these are a bunch of not so attractive organisms that we are exposed to in this country, and certainly when we travel. And that brings us to the end of tropical diseases.